Good morning, good evening, good afternoon. My name is Justin Kinadanta Santosa with the last three digits, my student number being 106, and I'm the head of P5. Today we'll present a presentation on our student project titled the Bence-Jones Protein Test. And these are our members.
Good morning, my name is Gabriela from Restafita with student numbers 118, and today I'll be explaining about the background of our paper. Analysis of human urine falls under the general term known as urinalysis, proven by earlier studies that the first morning voids are the best sample and the most reliable one compared to spot urine samples, because they are less influenced by external factors such as physical activity and hydration status. Morning voids are well used for physical, chemical, and microscopic examination of urine, and for the chemical examination used to encompass the detection of protein is a crucial one, considering protein in the urine leads to an abnormal condition of human's body. That would be all from me. Thank you.
Okay, I'm Fairoza Husni Adiba with 3 last digit of the student number 102. Next. Okay, so now I will continue the background of Bence-Jones protein test. It is one of the tests in urinalysis and was first conducted in Alexander McBean case, where in that case albumin test was performed, but rather than remaining its murky state after adding the nitric acid, his urine was back to its clear state, but after 1 hour later, it forms a firm yellow substance. The substance was then called Bence-Jones protein, which can detect multiple myelomas, which we will further discuss better. Next.
For the problem formations, we need to know first about what is Bence-Jones protein, what is the principle and use of Bence-Jones protein test, how is the test conducted, and what is the mechanisms of the test. And for the purpose are divided into general and specific one. Generally, this project is aimed to have a comprehensive understanding of Bence-Jones protein test, and specifically to provide a deeper understanding about Bence-Jones protein and its test, to understand about the principle and utility of the test, to provide a further understanding regarding the mechanisms of the test, and also to discuss about the advantages and disadvantages of Bence-Jones protein. That would be all from me. Thank you.
Okay, so for the benefits on making this paper, you can read here in the slide. There's theoretical benefits and practical benefits. And that's all from me. Thank you. Next.
Good morning, my name is Neta with student number 112. Bence-Jones protein are immunoglobulin light chains that are found in excess in urine in multiple myeloma. BJP showed poor thermal reactivity in heat coagulation test and won't be detected through the proteinuria detecting dipstick because dipstick is made to detect the presence of the albumin. BJP are produced and secreted by plasma cells usually associated with a malignant immunoproliferative disorder. They simply circulate in the plasma, are by the kidney, and excreted into the urine.
And my last three digits is 105. I'm going to explain what Bence-Jones protein test. Bence-Jones protein test is a method for testing a protein in a form of light chain of immunoglobulin that does not bind with a heavy chain, which can be detected by using electrophoresis. Clinical significance of Bence-Jones protein test is that can be used for detecting multiple myeloma, strong macroglobulinemia, amyloidosis, lymphomas, chronic lymphocytic leukemia, and Fanconi syndrome.
Let me introduce myself. My name is Ida Bagus Trisna Indra Putra Pramana with the last three-digit number 104. So the first disease is multiple myeloma. Bence-Jones protein is crucial in both detection and survival of people with multiple myeloma. Numerous free immunoglobulin light chains are produced by the plasma cells of individuals with multiple myeloma, then pass through the glomerulus to the urine. The next one is malignant lymphoma. Bence-Jones protein findings in patients with malignant lymphoma could be one of the diagnostic tools. Besides positive results for the Bence-Jones protein test, patients with malignant lymphoma could also show elevated IgM and lymphadenopathy leading to the diagnosis of malignant lymphoma. The next one is amyloidosis. Patients with amyloidosis frequently exhibit B2 microglobulin increase and Bence-Jones proteinuria, which are non-specific but non-indisputable indicators of tumors.
Let me introduce myself. My name is Samantha Petronella Theobald with NIM 220251108. The adult Fanconi syndrome is a dysfunction in the proximal tubule that will lead to the degradation of absorption function. Fanconi syndrome are caused by tubular damage that will secrete excessive amount of Bence-Jones protein that will be detected by the test. Waldenstrom macroglobulinemia is a rare lymphophagocytic lymphoma, and on diagnosing the disease, a positive result for Bence-Jones protein is crucial. Monoclonal gammopathy of undetermined significance is a pathological condition where monoclonal paraprotein is detected in the blood, but no end organ is present in multiple myeloma disease. In order to anticipate the risk of progression, early detection and prognostic markers using Bence-Jones protein are recommended.
Hi, my name is Berakar Koresmavati, with last digit of my student number is 103. Principle of Bence-Jones protein. So the Bence-Jones protein test is to check for certain proteins in urine that can indicate medical condition like multiple myeloma. The normal range of this protein in urine can vary depending on the lab test and the test method used. A 2018 study found that normal level for this protein range from 3.3 until 19.4 mg per liter for one type called kappa and 5.7 until 26.3 mg per liter for another type called lambda, and level may also be higher in older people. Thank you.
Greetings, I'm Janice with the last three-digit number 119. In patients with Bence-Jones leak out in the urine due to FLC's overflow in the forms of free kappa and lambda, and the best option for BGP detection is the capillary zone electrophoresis. In CZE, the negative charges in the tubes with the alkaline buffer create endosmotic flow which will pull and separate the proteins based on the weight. This will be then projected to the electrophoregram. As seen on the screen, the normal serum will show 6 normal peaks, while the patients will show irregular peaks, indicating the presence of FLC.
Hello, my name is Natasha Pramatia Putri with student number 2202511111. The requirement for Bence-Jones protein are minimum 10 milli urine sample, a sterile and leak-proof container, electrophoresis chamber, and then concentrator. For specimen collection, we need early morning urine. Collect the urine in a sterile and leak-proof container. Write the patient identity and the time of collection of the sample on the table on the container. And then the test should be done before 1 hour after specimen collection. Methods are urine protein electrophoresis, immunoelectrophoresis, and immunofixation electrophoresis. A urine protein electrophoresis is a test for detecting if there are any protein and the number of protein in the urine. And immunoelectrophoresis can detect small molecular light chain that cannot be detected with basic electrophoresis. Immunofixation electrophoresis is more sensitive to detect monoclonal protein and determine heavy chain in light chain type. This is used to determine kappa, lambda, IgG, IgA, and IgM.
Allow me to introduce myself. My name is Tracy Oral Geraldi Akema with last three-digit NIM number 115. The advantages of Bence-Jones protein test is that there are no risks in doing the test, and there are also new improvements, which is using immunoassay to measure and express ratios of free light chains accurately that can diagnose multiple myelomas up to 100% that are very accurate and affordable. But the disadvantages is that the recommended collection, which is 24 urine collection, is very difficult, and doing so will increase the chances of inaccurate results.
Okay, let me introduce myself. My name is Valentino Chandrawijaya, which digit of NIM number is 116. So, Bence-Jones protein test is a test that uses light chains of immunoglobulins called Bence-Jones protein to detect several diseases and use urine as a sample. And there are some methods to do this test, such as immunoelectrophoresis and immunofixation electrophoresis. Abnormal concentration of free light chains indicates a positive result of this test. The advantage of this test is that there are no risks, and disadvantage of this test that urine sample are difficult to collect.
So for the suggestion, the Bence-Jones protein test should be used in the proper conditions, as sampling and analyzing the sample is not an easy feat. So in order to preserve time, energy, and accuracy of diagnosis, the Bence-Jones protein test should only be done in cases when it is indicated necessary to do so. And that concludes our presentation for today. Thank you for your attention.